Hello everyone, I just want to share with you some basic biomechanic principles for actions of muscles. It's so much better to learn these principles first before you start memorizing any actions for muscle, because it just saves you so much time when you know the why behind all these actions that you're going to see throughout the chapter. Well, first of all, you should know that all muscles will have two insertion points, two attachment points. One is the origin. This is the stationary attachment that will not move based on the biomechanics. The other is the insertion. This is the mobile attachment. This is the part that will move. So in a case where you're talking about the movement of the arm or the humerus, that muscle must insert to the humerus. In other words, all muscles must insert to a bone in order to move that bone. So you have to know the difference between the origin and insertion before you start studying actions. Second, muscles only pull, they don't push. So anytime you do get an action, it's nothing more than describing our next principle of the insertion moving toward the origin. So that mobile attachment always moves toward that origin attachment. In simple way to remember that would be, wherever the muscle is located, that's where the bone will move. If we look at this biomechanic chart, for example, you can see when we compare actions of the shoulder that you have two options, humerus muscle actions and scapula muscle actions. So spend some time learning each of these words that will give you actions of the humerus and each of those that will give you actions of the scapula. It's a different population of words. So in other words, we don't want to say that we want to flex the scapula and we don't want to retract the humerus. We want to use the specific actions listed. So for the humerus, we have flexion, extension, abduction, and adduction. Scapular motion would give us protraction, retraction, elevation, and depression. And if you see that middle column, this just dictates wherever the muscle is located will give you a certain action. So in other words, any muscle that inserts to the humerus or crosses the glenohumeral joint that's located anteriorly to that joint will be a flexor. In other words, or for example, the pec major, since it's an anterior muscle, since it inserts to the humerus, it will be a flexor. Comparatively, a protractor that's anterior, that's going to move the scapula. If you look through the chart, every time you see a location of a certain muscle, look at where it's going to go. If you look through your insertion notes, you'll notice every time a muscle will insert to a certain bone, that bone will move, and it'll always move insertion to the origin. So follow this chart, go through each of your muscles, find the location of that muscle, and test the chart out. It's a good idea to try to find two actions at least for every muscle. Not all muscles will have two. But use this chart and your muscle list to try to find each action by the location. Thanks, I hope this helps, guys. Have fun.